यानी हम सोच रहे हैं कि बहुत सारी बीमारियों का इलाज इन दवाइयों में है, but it is not like that. Body itself can recover its own disease. There are two types of disease. There are दो तरह की दवाएं बीमारियां हैं. क्या? One is lifestyle disease, one which is created by your lifestyle, and one is created by infection, by bacteria, fungus, and all. So those diseases which are created by fungus and all can be recovered by medicines. But those things which are non-communicable, we call it non-communicable, यानी एक दूसरे से communicate नहीं होती, उसको that diseases can be recovered by the body itself. The recovery of the body, especially about the brain damages like stroke, paralysis, transverse myelitis. I'll show you one video today about a patient whom I recovered of transverse multiple sclerosis. एक मल्टीपल स्क्लेरोसिस का पेशेंट का मैं एक आपको वीडियो दिखाऊंगा जो पेशेंट 100% ओके हो गया. यू आर हैविंग सीवियर पेन व्हेन ही केम टू मी. उसको बहुत सीवियर पेन था. एंड नाउ यू कैन सी दैट पेशेंट कैन वॉक ब्यूटीफुली. ही हैज वॉक्ड यस्टरडे 12 hours in Film City and he was okay. So that inbuilt capacity of the body to recover its disease is called what? Neuroplasticity. यानी हमारे शरीर की ब्रेन की अंदरूनी शक्ति जो हमें नई चीजें सिखाती है, पढ़ाती है और हमें रिकवर करती है डैमेज से, पैरालिसिस से, स्ट्रोक से और अलग अलग बीमारियों जान जिसको हम लोग नाइलाज बीमारी कहते हैं, ऑटोइम्यून डिजीज, उस बीमारी को रिकवर करने के लिए ये बीमारियां काम आती है.
Yes, sir.
So next slide. You know why I'm telling you this? So that you can understand while putting needles how people recovered. Needles लगाने से recover कैसे होता है? It is called spark in the machine. अब थोड़ा सा एक अच्छा सही तरीके से इलाज करें. If you do a proper treatment in a proper method and a proper knowledge, you can recover large number of patients. You will see in my video there are 250,000 testimonials. How much? More than 250 testimonials, 50,000. So if testimonial, if you see, you can understand how beautiful to recover large number of diseases. Frozen shoulder can be recovered in 1 minute, 2 minutes. Many tendinous tears, many tendinopathies can be recovered in just 1 minute. So what are the cases of brain damage? Basically, will be for go one before. Basically, brain tumor, one before. Brain tumor, cerebrovascular disorders, closed head injuries, infection of the brain. Any brain tumor, cerebrovascular disorder, any strokes. There are two types of strokes, ischemic and hemorrhagic, any bleeding or non-bleeding, closed head injuries, and infection of the brain. Next. Next. Then come neurotoxins. Neurotoxins like Alzheimer's, Parkinson's, all they come in neurotoxins. Right? They are called neurodegenerative diseases. What they are called? Neurodegenerative diseases. Then comes genetic factors. So many genetic factors creates lot of diseases. Understood? Any more questions up to now? Any questions?
No, sir.
Okay. Go ahead. Next. Next slide. So what is a tumor? Then the other name of tumor is called neoplasm. What it is called? Neoplasm. It's a mass of cell that grows independently in the rest of the body. And it is called cancer. यानी ये एक सेल है जो अपने आप ग्रो करते जाता है और जिसकी डेथ नहीं होती. जनरली दो प्रोसेस होता है, माइटोसिस एंड मियोसिस. सो माइटोसिस प्रोसेस में क्या होता है, मदर सेल से दूसरा सेल प्रोड्यूस होता है, यानी फ्रॉम मदर सेल न्यू सेल्स आर प्रोड्यूस्ड. सो इन दिस केस न्यू सेल्स आर नॉट प्रोड्यूस्ड, द एक्सिस्टिंग सेल कीप्स ग्रोइंग and it becomes a cancer. And this is called neoplasm. What it is called?
Neoplasm.
Right. %20 of the brain tumors are meninges, encased in meninges. So 20% of the brain tumors are in the meningeal area of the brain. One meningeal area is there where you will find 20% of the brain tumors. So they are called meningeal tumors, right? And they keep growing in their own membrane. So they don't grow outside the membrane, they grow inside their own membrane. So they are called meningiomas. It is, they grow in their own membrane. Right? Next.
Yes.
Usually benign tumors are surgically removed. So these tumors generally create pressure inside the brain. ये ट्यूमर्स बढ़ते बढ़ते दिमाग के प्रेशर को बढ़ाता है और उसके बाद दिमाग को डैमेज करता है. इंटरनल प्रेशर ऑफ द ब्रेन damages the brain. So what will they do? They remove the tumor externally. They remove your tumor with a surgical procedure. And it's very easy, the latest mechanism. The minimal invasive procedures are required. मिनिमम बहुत कम छोटे से प्रोसीजर से बड़े ब्रेन ट्यूमर को आप निकाल सकते हैं. Really, all benign tumors are surgically recoverable. I'll bring water. Most sperm tumors are infiltrating, grow diffusely through surrounding tissue. Many difficult to remove and or destroy. So there are two types of tumors. What are they? Write down. One is cancerous, one is non-cancerous. What are they? Cancerous and non-cancerous. So non-cancerous tumors also become metastasis, right? So you can see those who are non-metastasis cancer, यानी जो कैंसर फैलते नहीं है, उनको बहुत अच्छे से रिमूव किया जा सकता है विथ एवेक न्यूरो सर्जरी. मतलब आप आंख खोल के बात भी कर रहे हैं और ब्रेन ट्यूमर को निकाल भी पा रहे हैं. डॉक्टर लक्ष्मीनाथ ऐसा करते हैं, माय फ्रेंड, excellent neurosurgeon, and you can see you will also take some classes. Other doctor people also will take classes. You collect around 200 students, more doctors will take the class, right? And non-malignant tumors can be recovered. Now, what is brain tumors? About 10% of the brain tumors are metastasis. Right. What is metastasis? Metastasis means primary tumor is elsewhere and the secondary tumor grows in the brain. They originate elsewhere and usually in the lungs. So they originate where? They originate in the elsewhere, anywhere else in the body and grows in the lungs. Right? Next. So you can see there is a circle inside where a red mark is given. It is called neuronoma. The arrow indicates the tumor. This is called the tumor. What it is called? The brain tumor. Now to remove this tumor, you must go through a certain way inside the brain, and that is called brain mapping. The brain mapping what we do, हम लोग जो ब्रेन मैपिंग करते हैं वो पेशेंट को पैरालिसिस, स्ट्रोक ये सब से रिमूव करती है. Otherwise, this brain mapping, what they do is to remove the tumor. Right? Do you have any questions which you want to ask me up to now? Any questions? Any question?
सर एक बार सर इसको एक्सप्लेन कीजिए जो आप बता रहे थे. एक रिमूवेबल और एक अनरिमूवेबल ट्यूमर है जिसको
देखो
हम
बेटा,
रिमूव आसान.
रिमूवल का मतलब होता है जो कैंसर ट्यूमर होता है. कैंसर मतलब आप समझते हैं ना, कर्कट रोग. जो
जी जी जी.
कर्कट रोग कहीं और होता है और दिमाग में जाके फैल जाता है, वो रिमूव नहीं होता है. बेनाइन ट्यूमर मतलब वो ट्यूमर जो खाली ब्रेन में ही रहता है और वो नॉन कैंसरस होता है, वो फैलता नहीं है. तो उसको काट के निकाल देने से ब्रेन पर कोई एडिशनल प्रेशर नहीं पड़ता है, इसके कारण उसको निकाला जाता है. इसलिए ट्यूमर के दो हिस्से किए जाते हैं. क्या क्या? बेनाइन एंड कैंसरस. उसको क्या बोलते हैं? मेटास्टेसिस. प्राइमरी और सेकेंडरी. प्राइमरी मतलब खुद का, सेकेंडरी मतलब कहीं और से जन्म लेना उसका. समझ में आया आपकी बात?
सर मतलब सर प्राइमरी इजीली रिमूव हो सकती है.
प्राइमरी रिमूव नहीं होती बाबू. कैंसर तो ये फर्स्ट स्टेज या सेकेंड स्टेज में यू कैन बी ट्रीटेड. एक बार मेटास्टेसिस हो गई तो पेशेंट का डेथ निश्चित है.
ओके सर.
समझ में आ गई बात?
यस यस.
तो ऐसा मेडिकल टर्मिनोलॉजी ये बहुत जरूरी है. So now we will be studying. Very simply, we have understood about two things. What are the benign tumors, and I'll repeat about the non-cancerous tumor. The classification of tumor is two types. What are they? Benign and non-benign. Right? Cancerous and
non-cancerous.
yes. Cancerous tumors are of two types: metastasis and primary. Right? यानी प्राइमरी मतलब कहीं और से जन्म लेता, मीन्स The primary is it may be in the lungs and it spreads in the brain. And other is, you know. Now, so you want to ask me anything about brain tumor cancer? Please ask me. किसी को कोई सवाल कुछ पूछना हो ब्रेन ट्यूमर पर कैंसर पे ब्रेन ट्यूमर्स पे सर्जिकल नॉन सर्जिकल एनी क्वेश्चंस कोई सवाल क्योंकि आगे जाके ये फाउंडेशन है अगर अभी आप गलत करेंगे तो आगे आप कुछ भी नहीं समझ पाएंगे बिकॉज टुमारो आई से बेनाइन ट्यूमर विल नॉट बी एबल टू अंडरस्टैंड टुमारो आई विल बी एबल टू से मेटास्टेसिस कैंसर का ट्यूमर ये है आप कुछ नहीं समझ पाएंगे सो दिस टर्मिनोलॉजी इज मस्ट फॉर यू टू अंडरस्टैंड व्हाट इज व्हाट राइट दिस इज द फाउंडेशन ऑफ द सब्जेक्ट व्हाट इज दिस इट इज द foundation of the subject. So do you want to ask me any questions?
Yeah, G.
Sir, please tell me.
Yeah, what do you think of the prospect of PDT therapy? PDT therapy.
Photodynamic therapy.
That's right.
It is given in the eyes actually. Yeah, generally there is a neovascularization. We call it neovascularization. Here there is a hemorrhage inside the eye, paramacular hemorrhage, right? So when there is a hemorrhage inside the eye, the small vessels they grow inside the eyes, which are weak in nature, right? So because they are weak in nature, what happens? If you don't destroy them, they will bleed and they will destroy the eyesight. You understood? So
Yes.
what they do, first they insert a dye and then they give a laser to it so that the existing vessels which are growing will destroy. Although the destroyed area will lose its vision, but the entire eyesight is not lost. It's called PDT, photodynamic therapy.
Yes.
Am I right?
Yes, but for the brain is still no chance.
No, in brain it is very difficult. Brain needs a good surgery. We have embolized many types of tumor. I want to teach you, but first you have to clear lot of foundation to understand how to understand which kind of tumor you can recover, benign tumor and all, with the help of dry needles. It will take time, but if you continue journey with me regularly, I can teach you a lot of things.
Okay, thank you.
So up to now, everything is clear to everyone?
Yes, sir.
Any doubts? Any problem? Because we are going to next chapter.
Sir, I have to ask about primary and secondary tumor.
Say primary tumor means the tumor which grows inside the brain, right? It
Okay.
does not grow from anywhere else. Secondary is a metastasis. Iska primary, it can grow, it starts growing in the lungs and then it enters the brain, right?
Yes. Okay.
So you may have it in the stomach also, you may have it in the spine also. Like you can have a tumor in the liver, but you can see the metastasis in the spine.
Okay. Thank you.
The primary means tumor is first, it is the first tumor. Second tumor, you will find it in the brain. It is called metastasis. What it is called?
Metastasis.
Yes. And primary tumor. Primary means the first tumor. Clear?
Yes, sir.
Yes. Any more questions in this topic?
No, sir.
Any more topic? Any more questions?
Good evening, sir.
Yes, tell me.
Also, you said that the tumor in the brain can be done by mapping. But
See,
in
there are two
other,
types of brain mapping. One is done for surgical brain mapping, in which we open the brain and we do surgery. During this surgery, we use this various types of endoscope and all, so that the patient is awake. Awake means patient sota nahi hai. So during that period, we remove the tumor. The moment we see there is a deficit or some problem is there, we stop the surgery. It is called brain mapping, right?
Yes, sir.
But the brain mapping, what we do is to revive the brain from the damage caused by the surgery or by the stroke or from any disease. Right?
Okay, sir.
Clear?
Yes, sir.
Next.
Hello.
Yes.
Hello. Good evening, sir.
Yeah. Yeah, may I
Sir,
know speaking?
this is Anand Maurya, sir.
Ah.
Sir, during the surgery, while performing the surgery for the tumor removal, that you say the patient is awake, it is just a particular means it is a particular specialization that surgery performed with a
Yeah, it is called
patient is
microvascular
awake.
surgery. It is called microvascular surgery.
Okay, but patient is awake just to
The
test
patient is fully awake
something.
and patient can talk during the whole surgical procedure. The relative of the patient is sitting. Patient is trained. Then during the whole surgical procedure, he reads poems, he reads drums, he sings, he can even you will see he can play piano.
In that procedure, the patient is awake just to see the everything, every function is right.
Yeah, because during removal of the tumor, we are afraid that we may damage many other things. So
Okay, sir.
when we remove
Yes.
the tumor,
Yes.
other deficits not come. If other deficit is coming, we close the tumor, right? We finish
sir.
the surgery at that period.
Yes,
We
sir.
remove only the tumor up to which there is no damage. Then secondary tumor is done by radiation and chemotherapy.
Yes, sir.
Okay, sir. Okay.
Am I clear?
Yes, sir. Yes, sir.
So any doubt in brain tumor? किसी को कोई डाउट है, कुछ पूछना चाहते हैं?
सर केमोथेरेपी जो है सर ये मस्ट भी है जो कि कैंसर पेशेंट के लिए दिया जाता है लास्ट स्टेज में।
देखो बेटा हमारे पास और कोई इलाज नहीं है, बट देन दिस इज मुझे भी कैंसर है, मैंने तो नहीं लिया आज तक, and I'm still working more than 100 patients a day and I'm doing good.
ओके सर।
मैं तो मेरे पास तो कोई भी नहीं है, मैं अकेला रहता हूँ। I built up 40 bedded center. अब तो आप लोग MSc दिलाने के लिए भी अब talk to the university also. Very soon MSc courses will be started. Diploma and MSc will be started. So any more questions? This is your foundation. Understand? कोई भी बात हो आप प्लीज पूछिए, डरने की कोई आवश्यकता नहीं। मैं भी आपकी तरह एक इंसान हूँ, कभी कभार गुस्सा आ जाता, कोई बात नहीं, मेरी आवाज ही ऐसी है। आप प्लीज मेरी आवाज पर मत जाइए, डोंट गो विथ माय वॉइस। इफ यू हैव एनी क्वेश्चंस प्लीज आस्क। माय ओनली रिक्वेस्ट टू यू इज प्लीज spread this message to many people so that more and more people can join and encourage people to improve their knowledge so that we can try to recover large number of paralysis patients, we can recover large number of pain patients, we can do a lot of recover what patient going to kidney trouble, because if by eating regularly painkiller we damage the liver and kidney. Our purpose is to serve the vital organs of the body, otherwise the patient will have a pathetic death. Clear?
सर सर ट्यूमर और कैंसर सर दोनों में सर डिफरेंट थिंग्स है ना सर। ट्यूमर इज द मसल जिसमें हमारी हार्ड हो जाती है और एक्स्ट्रा बढ़ जाता है। और
नहीं ऐसा नहीं,
तो सर
ट्यूमर
सेल्स की
नहीं ट्यूमर मैंने आपको पढ़ाया ना, ट्यूमर इज एक्स्ट्रा ग्रोथ ऑफ द सेल।
यस यस
आप जो बोल रहे हो वो लिम्फोमा बोल रहे हैं।
अच्छा सर जैसे मांस बढ़ जाता है, मसल्स बढ़ जाते हैं।
लिम्फोमा।
अच्छा और सेल्स सर जहाँ पे डेड हो जाती है, ये तो कैंसर की स्टेज है ना जहाँ पे सेल्स डेड होती है और
ये
रीजनरेट
सेल्स
नहीं हो
डेड नहीं
पाती।
होती, सेल्स ग्रो होती जाती है।
ओके।
जनरली सेल्स डाई आफ्टर देयर सर्टेन परफॉर्मेंस, सेल्स डाई, बहुत काम करने के बाद सेल्स मर जाती है। बट जो सेल्स मरती नहीं है वो ग्रो करती है। द सेल्स व्हिच डू नॉट डाई, they keep on growing and they only become the cancerous cell.
ओके ओके सर। सर
समझ में
आई
आया?
रिक्वेस्ट सर एक बार सर इसको एक बार रिपीटली बता दीजिए ना, जो कैंसर की जो टाइप है सर उसको और एक बार सर
अरे दो
जानना
ही
था
टाइप
सर।
है बेटा, बेनाइन और मेटास्टेसिस। तीन टाइप है, प्राइमरी, मेटास्टेसिस और बेनाइन। ठीक है बेटा?
जी सर। सर जो पैरालिसिस वाली होती है, जो क्लोटिंग वाला, और एक
ठीक है, वो उस
इसमें
सब्जेक्ट पे नहीं गए अभी हम लोग। आप खाली एक
ओके
टॉपिक पर रुकिए। आप एक जगह से एक जगह छलांग मारेंगे तो नहीं होगा। आप खाली अभी
यस यस
कैंसर पर रुकिए,
ओके सर।
पे नहीं है, सेरिब्रोवास्कुलर डिजीज।
जी सर।
समझे आप?
जी सर।
Now we'll go to the next topic. What is called cerebrovascular accident. Why it is called accident? Because there is a rupture of vein or infarct of vein. There are two types. What are they? Hemorrhagic and non-hemorrhagic. Write down. One is bleeding, one is non-bleeding. Hemorrhagic and non-hemorrhagic. Clear?
Clear, sir.
Yes, sir.
So you will see the third cause of the death of the tumor is because of the tumor in US and India and many other countries. It is because of gut-brain toxicity. It is because of what? Gut-brain toxicity, about which we will speak later on. Am I clear?
Yes, sir.
Sir.
Right? गट यानी गट से ब्रेन तक वेगस नर्व जाता है। उसमें आप ग्लूटेन, आर्टिफिशियल शुगर, you give non-vegetarian items, you give lot of things. So what will happen? The gut will damage and the brain will also destroy through the vagus nerve. And he will have epilepsy, this, that. Next. Now comes the cerebral hemorrhage. Cerebral hemorrhage means blood vessels are ruptured. So you will see blood vessels are ruptured. There are many blood vessels inside the brain, right? Brain is full of blood vessels. So now what happens? These brain vessels, they get ruptures. What is the primary cause of rupture? Rupture matlab टूट जाना. What is the primary cause? Can anyone tell me? Walid will give me one chocolate.
Yes, sir.
Yes, sir. What I am telling? I am telling. Blood vessels are ruptures. What is the main cause of rupturing the blood vessels? Reason for blood rupturing. Rupturing matlab टूट जाना. What is the main cause of that?
High blood pressure.
Yeah, it is called essential blood pressure. What it is called? Essential blood pressure or blood disease, brain disease. It happens because of two reasons. What? Blood disease. And one third cause is aneurysm. What is aneurysm? The clotting of the blood vessels. So this clotting keep increasing and it may rupture. So all these three are the reason of cerebrovascular accident. What it is called? CVA. What are the three reasons? The three reasons are rupture of the vessels, then aneurysm, and diseases inside the brain. Am I clear? Like
Yes,
tumor and all.
Yes.
They are identified by Glasgow Coma Scale. What they are identified by?
Let's go. Coma scale.
Yes. Write down GCS. They are identified by GCS.
so please repeat the full form, sir.
GCS, Glasgow Coma Scale. Here the marks are E4, V5, M6. Total 15. Am I clear?
Yes, sir.
Yeah. Next slide. Now, because ischemic stroke. So what is ischemic stroke? Generally, the supply of the brain. We know what are the arteries? Middle cerebral artery, anterior cerebral artery. There are various arteries inside the brain. Clear? So these arteries, when they stop supplying blood vessels inside the brain, what will happen? The area will become dry, the tissues will die, and the patient will die. Now, another reason is thrombosis, a plug form in the brain. Now, thrombosis is a example. There is a clotting inside the artery, femoral artery in the leg. This artery called femoral artery, right? There is a thrombosis. Thrombosis means clotting. So what happens? This clotting they break, because if you don't remove this clotting by conservative medicine like heparin and all, this clotting they breaks and they can enter into the lungs or in the brain. They can enter into the what?
Lungs and brain.
Yeah. And this is called what? Thrombotic bleeding. Am I clear?
Yes, sir.
Next. Next. So what are the two types of bleeding? First, let us again repeat. The tumor are of two types, benign and ischemic. Benign and cancerous or malignant. Right? Second is hemorrhage, ischemic and non-ischemic. That is hemorrhagic and non-hemorrhagic. Right? Am I clear?
Yes, sir.
Next. So damage in the brain does not develop all of a sudden. It takes a due process to develop. Now we do not recognize this due process. We generally ignore. And after a certain times, when the symptoms comes, we try to treat the disease. For example, we have started forgetting small things. We forgot this, we forgot that. We ignore it. We think that it is like that only. But it is not like that. It becomes a cancerous cell. Clear? So most of the damage in the brain is occurred by which of the transmitter? It is called glutamate. Write down. Which transmitter?
Glutamate.
Gluta? Yes. Next. Next slide. So blood supply, what happens in ischemic stroke? Blood supply to the brain vessels becomes slow and they release what? Glutamate. They release glutamate. ENT. वो मंडे को तो आते हैं बाबू, वो रूम में करते हैं. आज आप नहीं रहेंगे? आज आप नहीं रहेंगे यहाँ? नहीं, अभी जा रहा हूँ, मॉर्निंग तक. ये तो कल करवा देंगे, एक की बात है. ठीक है. So glutamate overactivates its receptors. There are two types of things. One is called receptors, one which receives, right? Like in dopamine, one is giving, one is receiving, right? It is called transmitting and receiving module, TR module. So in glutamate, when overactivates its receptors, especially NMDA, what it is? NMDA receptors leading to the influx of sodium and calcium, they becomes influenced. And you have what? Ischemic stroke. And it damages the brain, and it is called brain stroke. So generally, what do you get in 80% in the market is the brain stroke due to ischemic stroke, right? The influx of the calcium and trigger channels are in triggers, means they are released more. So when you think more, when you think negative, when you put lot of stress in your brain, what happens? They are released more. It is called action potential. So when they are released more, these transmitters are released more. Then what happens? There is more release of the glutamate. So since there is more release of the glutamate, it is called what? Ischemic stroke. In Hindi, it is said, Chinta Chita Jagat Banati hai. Means if you take more stress, you will get more disease. And this is of the reason why you get more brain disease, more brain stroke, more ischemic stroke these days. Am I clear? Any questions up to now? Any questions? Any questions?
No, sir.
Next. So because of the glutamate is there, the neurons are dead. Now you understand, if the neurons in the brain are dead, how exercise will improve them. Can exercise create new neurons? It becomes a long process and it becomes neuroplasticity. There we use a brain impulse. What it is called? Non-invasive brain stimulation. What do we call it?
Non-invasive brain stimulation.
NI?
NIBS.
NIBS.
Here we prick small needle in an anatomical area. We select certain anatomical area of the brain after reading the brain, and we find which area will help. We put the needle in that particular area, knowing the geographical area. Means after reading the brain, we understand this area is here. So we insert the needle here with the help of our 5 fingers. And then these 5 fingers help you to map the brain. And then we map this brain, and then we increase the what? Impulse. This impulse increasing recovers the brain, and that is called what? Neuroplasticity. There are two types. What are they? Neurogenesis and angiogenesis. What it is called? Growth of
Neurogenesis.
extra vessels and growth of extra neurons. Am I right?
Yes, sir.
Any questions up to now? किसी को कोई सवाल? Any questions? मन में कोई सवाल है तो पूछिए प्लीज. कोई डाउट मत रखिए. Don't keep any doubts in your mind. Please ask.
No questions, sir.
Please tell me. Any questions? Next. See, all the ischemic stroke and the paralysis what you see does not recover because we do over exercise. Because of the exercise pull and push, it becomes spastic. Spasticity again becomes difficult because you have to give Botox injection. There is only one injection available in the market is Botox. We have developed certain stem cells and all which recovers what? Spasticity easily. Otherwise, if once a paralysis patient becomes paralysis forever. Clear?
Yes, sir.
Next. Ischemia-induced brain damage. We already know ischemic stroke damages the brain, and that is the part of CVA. It is called CVA, cerebrovascular accident. What it is called? CVA.
Cerebrovascular accident.
Very good. Mechanism of damage is vary with the brain structure and affected area. So wherever it is, the blood supply is reduced, brain neurons die, and that area becomes non-functional. Suppose my brain area, my function, the blood supply stops here. So this area is responsible for my memory. So now my memory is affected. Now if it goes to the motor cortex, you do not get the motor cortex, right? So you become paralytic. Now, to revival is different, but to understand the main thing is important. What? One is hemorrhagic. Hemorrhagic stroke is more difficult to recover. Ischemic stroke is more easy to recover. What you see by exercise and all is recovery of the ischemic stroke. You don't see the recovery of the what?
सर दो प्रकार के स्ट्रोक का बताया सर, हेमरेजिक स्ट्रोक और केमिक स्ट्रोक. डोंट
हेमरेजिक और नॉन हेमरेजिक. अब एक ही बात समझिए, एक ब्लीडिंग, दूसरा नॉन ब्लीडिंग, राइट?
ओके.
Next. Now you can see in this figure how glutamate clears the, so excess sodium and calcium channels are released and glutamate kills the neuron. Glutamate is a poison which kills the neurons. Once the neurons die, your body becomes non-functional. So it is called ischemic stroke. Right? Am I clear?
Yes, sir.
Am I clear to all of you?
Yes, sir.
Sir.
Yes,
Yes,
वो
sir.
repeat कीजिए.
sir. Yes, sir.
Next. So now you are speaking about the clot. One person was asking about the clot. Yes, this clot are the closed brain injuries. What are they called? Closed brain injuries. This clotting is defined as closed brain injuries. The clots occur inside the brain, and because of that, the area becomes non-functional. So it is called what? Clot. Right? Generally, it becomes because of the plague. Plague means यहाँ जमा हो जाता है क्लोट, वो ब्रेन के अंदर चला जाता है और उसके कारण क्लोटिंग हो जाती है या और किसी भी कारण से हो सकता है. तो दिस क्लोटिंग डैमेजेस द ब्रेन. इट इज कॉल्ड क्लोटिंग ऑफ द ब्रेन. क्लियर?
Yes, sir.
So injuries are always on the one side. If you have right side injury, you will have left side paralysis. If you have right side injury, you will have left side paralysis. Clear?
Yes, sir.
It is called contralectual. Clear?
Yes.
Yes, sir.
Next. Now, this injury creates a hematoma. It creates bleeding inside the brain, right? The clotting, what does clotting do? Clotting creates hematoma. Hematoma means bleeding inside the brain. And the more the bleeding inside the brain is there, the more the brain is damaged. So we have understood three things: ischemic, non-ischemic, and hematoma, right? Hemorrhagic, non-hemorrhagic, and hematoma, right? Hematoma means a clot enters the brain, it bleeds, and it happens. And fourth is aneurysm. That means the enlargement of the brain artery. It bursts and the bleeding comes. Right?
Yes, sir.
Am I clear to all?
Yes, sir.
Philippines and other countries, Malaysia, Philippines, Hong Kong.
Yes, sir.
Sir.
Nigeria, am I clear?
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Next. Just close the mic. Someone has opened the mic. Next. So sometimes you do not get any evidence of the what? Structural damage. The clot damages internally. When you see MRI, you don't get any structural damage. That there is some structural damage inside the brain. बिल्डिंग के अंदर कोई डैमेज हुआ है वो आपको दिखाई नहीं देता, और अंदर ही अंदर वो डैमेज कर देता है, and you become paralyzed and you become stroke and you suffer from different disease. So stroke is not a disease. Paralysis is not a disease. The cause which creates paralysis is a disease. Now you have to recover that part of the brain which has been damaged. So the recovery of that part which has been damaged is called as neuroplasticity. It can be done by triggering the neurons, by inserting the needle and pain. There are 3 types of brain stimulation. What are they? 4 types. What are the 4 types of brain stimulation? What are they?
Transcranial brain stimulation,
See, write down. Deep brain stimulation, non-invasive brain stimulation, NIBS. NIBS is classified into 2 parts, electrical and magnetical. So it is called transmagnetic stimulation and transcranial stimulation. What it is called? Transcranial. Transcranial stimulation means you insert some electric nodes, do brain mapping, and you put some electric current. And magnetic stimulation is called when you put magnet inside the outside and the repeated magnetic stimulation goes, which revives the neurons. But out of these 2 are not successful in recovery of the patient. So we have taken out the new technique. It is called dry needle brain stimulation, out of which you can see 250,000 videos in MKSASTRY. You can give my slide, my Facebook ID here, so that you all people can see how I have recovered 250 patients, 250,000 patients over Facebook, and more than 10 to 15 lakh patients over needling, which I have done from a long area. Clear?
Yes, sir.
Sorry, sir, will you please repeat it?
What you want me to repeat?
Sir, the 4 types.
What are the 4 types I have told?
Deep brain stimulation,
Ah,
non-invasive
so
stimulation.
okay.
Four
Deep brain
types.
stimulation. NIBS is classified into 3 parts. Transcranial electrical stimulation, transmagnetic stimulation, in which a magnetic is used to what? Recover the brain by continuous repetitive stimulation. And 4th is what we do, NIBS. NIBS is the easiest form and it gives the quickest result. Here, the rods are used as the needles. You put the needle and you stimulate, and the patient gets immediate results. Right?
So also dry needle brain stimulation.
That is only one, DNBS, dry needle brain stimulation.
Yes, sir. Okay. Thank you, sir.
What do you call that? Scalp acupuncture. In scalp acupuncture, you use acupuncture points. Here we map the brain as per the damage of the brain, and we find out the area how to recover the brain. It is most interesting, most effective, and immediate recovery is seen in the patient. When you put stem cell therapy, which is very cheap in our clinic, we give 5,000 rupees stem cell therapy, bone marrow, and other things which we give you over here. Right? Next. So there is not one single reason for this. There may be many single reasons for the brain clot. It may be drunk also. Drunk people means drunkard people also have a habit of brain clot in the brain. So it is said you should never drink too much, right? You should never drink too much. You may have a brain clot. Always have a balanced diet. Am I clear?
Yes, sir.
Any doubt up to now?
Excuse me, sir. A small question.
Yes, please tell me.
Sir, thalassemia can be cured by dry needles or something, sir?
See, you have to see the stage of the disease. What are the symptoms? What are the place? And who is treating it? The
Okay.
problem is the treatment is known not to much of the people. Without knowing how to treat the patient, to treat the patient, what will happen? It's same like you don't know how to drive the car, you do an accident. You do not know how to treat a patient. You're treating the most difficult disease. and you do not know how to treat it, what will happen?
Yes, sir. You meet accident.
Yeah, you will die.
Yes, sir.
Clear?
Yes, sir.
Next.
Thank you, sir.
Clear. Next slide. You can see subdural hematoma. You can see the bleeding red color which is there. It is because of the accident you have. Generally, the drivers and all in the front car, or you have a car accident. You see, this is the picture. What you got is as subdural hematoma. It is bleeding inside the brain. So immediately people do carinotomy. Carinotomy is not correct. You have to do cystonostomy. What you have to do? Cystonostomy. I.P. Cherian is the founder of cystonostomy and a future Nobel Prize winner of the world who has replaced 1905 surgery into a latest surgery of the brain. Now you can see, because the blood pressure is increased inside the brain, the left ventricle is displaced. It is called midline shift. It is called what? Midline shift. Brain is divided into two parts. What are the two parts? It is called great longitudinal fissure. What it is called? Great longitudinal fissure. यानी ब्रेन को दो भाग से डिवाइड किया जाता है. एक लंबी लाइन जो ब्रेन को डिवाइड करती है उसको बोलता है लॉन्गिट्यूडनल फिशर. व्हेन द ब्लीडिंग इज देयर, there is a midline shift. ये midline shift होती है. This midline shift, what will happen? It will damage the brain. So you do carinotomy. What do you call? You remove the cranial bone. After 3 months, again you put it. But here what we do? We don't remove the cranial bone. We do cystonostomy, and in cystonostomy, the patient is recovered in 5 to 10 days. But if you do carinotomy, you recover the patient in years after years, and sometimes the patient is not recovered.
सर सर प्लीज रिपीट दो प्रकार की जो बताया आप सर्जरी जिसमें रिकवर होती है और जिसमें
तो एक को
ओनली
बोलते हैं कैरिनोटोमी और दूसरे को बोलते हैं सिस्टेनोस्टोमी. सिस्टेनोस्टोमी में क्या करते हैं? व्हेन वी गो, वी मेक ए बेर होल, वी रिमूव द ब्लीडिंग, वी रिमूव दिस हेमाटोमा, एंड देन we go at atmospheric pressure and we remove the what? क्या बोलते हैं उसको?
Cranial bone.
No. Cranial bone is removed in craniotomy, which makes the patient into coma, and then you recover the patient years, months, and he never recovers sometimes. But in this cystonostomy, patient recovers very fast. So some of the best. So whenever you choose a surgeon, neurosurgeon, you should always take advice which is the best neurosurgeon who does surgery. Generally, we attend surgeries with the neurosurgeon. We see what excellence they do, and we see most difficult surgery, those who do easily is I.P. Cherian, Dr. Lakshminath. They are very good neurosurgeons. They operate the brain, and next day you can see, I saw a brain, it very difficult brain surgery was done, and next day the driver was driving the car. No, it is called encephalitis. It is infection, the resulting of the inflammation of the brain by an invasion of microorganism. So the microorganism is a bacteria enters the brain, and it creates what? Inflammation of the infection of the brain. It is called encephalitis. It is called what?
Encephalitis.
Encephalitis.
Yes. Next. So it is generally of theta bacterial infection, often lead to abscess in the pockets of the pus. So it is often abscess means a type of क्या बोलते हैं हिंदी में इसको पिप बोलते हैं इन्फेक्शंस हो जाता है उसके अंदर a typical type of infection takes place in the pouches of the bones and may inflame the meninges and creating meningitis. So it is called meningitis and it is often deadly. My mother also died with brain meningitis. Why? Because she had a bacterial infection due to sepsis. Urine infection is one of the most important reason of sepsis. UTI. What it is?
UTI,
Yeah, it is called
urinary tract
sepsis.
infection.
Urinary tract infection.
Yeah, it is called sepsis.
Yes, sir.
Next, the first choice of drug which we use for bacterial infection is penicillin. Which of the but who invented penicillin? Can you tell me? Who was the first scientist who invented the penicillin? Who gave his life for his
Mercury?
penicillin?
Alexander
Can you tell me his name?
Fleming.
No, Mercury.
No, it is Yellaparanga Dr. Subbarao, Indian scientist, who saw his wife 2 days only 1 day after marriage and 2 days after his death. He gave his full life for dedication, and that was my inspiration that I gave my full life for my dedication to my research so that I can take out new ways by which stroke and paralysis can be created and can be recovered as fast as possible. You can recover large number of diseases. You can see 250,000. You can see large number of hematomas, damages, all these are there in the brain, and all this we can recover. Next, there are two types of infection, viral infection. So this is attack neural in tissues. So you can see viral infections are like malaria also is a viral infection. COVID also is a viral infection. And other infections are also there, which affects the brain. And then the brain becomes like a rat-eating brain and it damages and the patient dies. And second is some can be dormant for years and they remain dormant for years, means the patient remains in a coma stage or dormant stage for years. Am I clear up to now? Am I clear?
Yes, sir.
Yes, sir.
Next. I already told you neurotoxins. There are many neurotoxins like amyloid beta proteins, tau proteins, S proteins. They are the G lymphatic system is a system by which the CSF fluid is stored in the supracellular cistern, right? From where the cisternostomy came. So supracellular cistern stores all the CSF fluid. So when at night you go and sleep, this this CSF cleans the brain. It is called cleaning and cooling of the brain, right? Am I clear? It is called what? Cleaning and
Cleaning and cooling the brain.
yes. So if the cleaning and cooling of the brain is not taken place, what will happen? You will suffer from Parkinson, Alzheimer's, and all other diseases. And they may enter through GI tract. The most important infection enters through what? Gastrointestinal tract or skin infection like tetanus or lung infections. We know lung infections are the most important infections which destroys the brain and the brain dies. Clear?
Yes, sir.
All of you clear?
Yes, sir.
Yes,
Yes,
sir.
sir.
You want to ask any question? You want to ask questions? So generally it is because of the mercury exposure. That is why mercury has been banned in the market. If you see in Malaysia and all, mercury, this blood pressure machine and all this is banned. Why? Because it creates toxicity and it may lead to what? Brain toxicity. So neurotoxins are also one of the reasons. Mad matter, that is head matters, often had toxic psychosis due to mercury exposure. So those people who have mercury exposure, those who are exposed to mercury, they are suffered from neurotoxins. Next. Next we'll teach you tomorrow, right? Now you may please put up the slides. Today you go to my Facebook, I'll show you how one patient was recovered by multiple sclerosis. Do you know what is multiple sclerosis? Can you read in Google first? What is multiple sclerosis? So generally we try to recover all types of brain diseases, spinal cord injuries. We have a team of 6-7 doctors. We try to give stem cell therapy and all. We give minimum to minimum drugs and we try to recover the patient with natural process. But any recovery takes time. It takes 2 to 3 to 4 months. Otherwise, it is not easy to recover a patient. Yeah. Right. एम.के. शास्त्री हैदराबाद से हमेशा हमें बहुत सारे केसेस मिलते हैं जो बहुत डिफिकल्ट केसेस होते हैं मेडिकल साइंस में जिसका बहुत ना इलाज बातें होती है we found very difficult to treat those diseases and among such diseases is multiple sclerosis. It's a patient of multiple sclerosis who had a varied symptoms and now you can ask him how is his condition. अब जब आए थे तब कैसे थे आपको कैसे?
अरे सर मेरे लाइफ में प्रॉब्लम थी और वो काफ़ी हद तक मेरा रिकवर हो चुका है मेरे लेग्स जो है बिल्कुल परफेक्ट हो गए पहले से और बहुत ज़्यादा डिफरेंस है ऑलमोस्ट 80 to 90% रिकवर।
जो एमआरआई निकाली थी पहले के एमआरआई और अभी के एमआरआई में कितना अच्छा लग रहा है?
काफ़ी डिफरेंस है सर पहले के काफ़ी डिफरेंस है।
So here you can see a multiple sclerosis patient. आप चल के दिखाएंगे। You can see now the patient is walking very nicely like a simple man without any other symptoms. He has recovered without medicine. He was given high steroid medicine. It reacted. As you can see, the patient is recovered by what? Simple needling, simple process, and stem cell therapy, which is very helpful for the recovery of the patient and which we give it at very low cost. Stem cell therapy generally in India is cost around $3,000 to $4,000, but we give it $100 only. Right. So you may ask me your questions if you have any more questions. I hope I was not too fast because I had to teach a long subject.
No,
I know I was fast, but
No,
the
sir.
subject is very big. So what are the things we learned? There are three types of tumor: benign,
Malignant.
non-cancerous, malignant. Over. Hematoma, non-hematoma, hemorrhagic, ischemic, right?
Yes, sir.
Yes, sir.
Then meningitis, it is a viral infection in the brain, and The first line of treatment is penicillin, and then we learned about surgery. There are two types of surgeries: craniotomy and cystonostomy. Clear?
Yes, sir.
You may ask me a question if you have any doubts. Can anyone write what is multiple sclerosis in Google? Can anyone read multiple sclerosis?
May I speak?
Yes, sir.
Multiple sclerosis, the patches are formed in the central nervous system, especially in the spine, and patient is unable to use his limbs. In their imbalance is there, gait problem is there, unable to sit, stand, and almost his whole body is paralyzed. And later on, he has to leave this world due to many complications that basically check
Can
from
you see multiple sclerosis, a demyelinating neuropathy in which the patches
demyelinating.
are formed in the canal of the
In the
cord, and the
canal,
cord is damaged, and then
yes.
gradually become patient loses his eyesight, voice, legs. Here you will find sensory and motor deficit, will become wheelchair prone, and he dies.
Ah. And he used to leave this world. I have seen hundreds of cases of multiple sclerosis.
Yes, we all have seen hundreds of cases. I have practiced for 34 years and I have recovered large number of cases. You can see a successful recovery of multiple sclerosis. Now, by checking his both MRIs, which I will show you tomorrow, maybe day after tomorrow, because he is gone today. So after a few days, you can check both his MRIs. The MRI done in Uttarakhand and here, you will find I have cleaned all his canals using what? Non-invasive brain stimulation.
Dr. Sastri, I am Gandhi from Chandigarh and very interested to listen to your lecture today. In a very simple way, you explain all the things for everybody.
See,
When
brain is
everybody can
the
understand
most important thing, Ms. Dr. Gandhi ji, is that
it.
it is very easy to recover patient. It is only what we did is that we made the things complicated to recover the patient.
Definitely, we have to put a lot of labor for recovery.
One is commercialization. Second is what? Non idea of recovery. Because we did not study, we kept ourselves in book. We never thought how to recover the disease. So disease did not recover. Otherwise, you see transverse myelitis patient. You see my transverse myelitis patient in advanced stage is walking like a normal man. Yesterday, he did a 12-hour walk. I was informed in the film city.
Yeah, I am in this profession of physical therapy 1978. After doing my bachelor and master degree, I found now there is lot of change in the protocol. In India especially, we are told if you become a medical practitioner, it's only to make money, not for the service to the humanity. That is basically basic problem in our culture.
No, see,
We
the
don't want to.
problem is not that also. The problem is more and more hospitals are coming, more and more competition is coming. So if one patient is coming, we try to take out the expenses of 5 patients from one patient.
It's all commercial now, sir. Today I came to know your organization charge 5,000 rupees for stem cells therapy. And in Pune, there is one doctor, Saniwada area, that area. He used to charge lakhs of rupees for stem cells.
No. Stem cells, we have developed very good quality of stem cells. We take out from bone marrow and we have done more than 300 procedures by now within 2.5 months. And all the patients have shown good recovery. Patients are admitted here. Our room rent is 1,500, treatment charge is 1,500. Stem cells, it depends which kind of stem cells you want. From 3,000 to 5,000, 6,000 rupees stem cells depends. I can show you we have started getting recovery in rhinititis pigmentosa on the first day of the treatment. So all these things are there.
No, sir, I'm very much impressed after listening your this lecture on screen, especially today. Last time I also attended your lecture on audio. This time you literally explained all typical and complicated matter in a very simple way. And everyone can understand it, having basic idea and knowledge of medical science.
See, that is
Yes,
called
sir. You are doing.
neuroplasticity. Every day now I'm
And-
practicing how to become a good teacher. Earlier I was a complicated teacher. Now I became a good teacher because of your blessing. Every time I read your remarks, and your blessings made me a good teacher. You always correct me. I always read your remarks. You correct me every day. I correct myself. Now I try to become a good teacher. So I think I'll be able to teach how to do neuroplasticity, how to recover stroke. And I request the people, those who cannot recover, please send it to us. Let us try to recover them. Let us not allow them to die in wheelchair. Let us give them a new life. That's it. What is my ambition is of.
Definitely, sir. You are doing lot good service. I'm a senior man. I can't do much. Due to physical
I am
restrictions.
also a cancerous patient, sir. Right now, I just finished my 10 days of heart attack. I had a severe heart attack. I was supposed to die. I was not willing to come back because of the work stress in my clinic. I thought it is better to die. But the doctor who was there, he started crying and I could not see his tears. He said, see, you are my only brother. You please take this injection, tropopin and adrenaline, and allow us to treat you. And after 6 hours, I wrote what you know in my medical sheet. I said, bring the medical sheet with full confidence. They thought I'm a doctor of the same hospital. They never knew I'm an attendant, patient, bring. And I wrote, prognosis explained. Doctor on high risk, patient on high risk may die in the car. Hospital not responsible. Hence discharge, explaining the prognosis. And I came alone. I went alone and I came alone. I live alone. Actually, I stay in a 44 hospital center. Patients are always full, but I always live alone. And my only entertainment time is spending time in the class. Rest of the time after 2 o'clock, I see the patients. You will find me after 2 o'clock in the clinic.
नहीं आई सर ट्राई टू मीट यू इन हैदराबाद सून थोड़ा मेरा हेल्थ भी ठीक हो जाए मिलता हूँ मैं सर
नहीं मे भी अब तो क्या मेरा भी हेल्थ बहुत खराब हो चुका है अब तो कैंसर भी लास्ट स्टेज में आ चुका है और 5वां हार्ट अटैक हो चुका है सो आई वांट टू कम टू दिल्ली आई विल बी अगेन प्लानिंग बट हियर वी आर प्लानिंग टू बाय 144 CT scan 144 slice CT scan so that I can teach you all the typical procedures over this. That is why I'm teaching you the basic things right now, so that when I go to the advanced level of brain mapping and all these things, you don't get confused. So I say, people, advertise more and more, bring more and more students. We are not charging any money. And when our brain, this what you will got, CT scan will come, we will do CT and we'll show you how we cut that area of the brain in the 3D and we stimulate the same needle over the scalp, and by 2 or 3 needles, you can see the changes in the brain. You may not recover the 100% cases, but you may recover 75 to 80% changes in the patient within few days.
In activity of daily living may be independent and he can manage himself well day to day work.
So you see, even after having 5 heart attacks, having an orphanage life, you can see how active I am.
Don't say this thing. I met only few doctors, few medical professors. One of them was Professor Larry of Banaras Hindu University. He is a known cardiologist and is still working. Maybe 80 plus now.
You know, the best thing of my life, Professor Dr. Gandhiji, is that after having the heart attack also, next day of the heart attack, I joined my duty.
So please take some rest. Take some rest. Please.
See,
we have to work
for
a very long
I always
time.
say, I will rest, but one day, it is called RIP.
We are bound to die. We are bound to die.
So, till then we have to work. People are suffering. See, the people which I have, they have come from the best hospitals of India. They are suffering. If I cannot recover them, if I cannot wipe tears from their eyes, I don't know what Allah will say about me. I can answer people here, But what will I answer God?
सारा वहीं जाके होता I am running
जवाब तो वही
charitable
देना है ना,
clinic.
मालिक को जाके जवाब देना है.
Still I am running charitable clinic, working 3-4 hours and treating joint
Now,
pain.
the
for
most
4
important thing
days.
in our charitable clinic is that all the inpatient in the same package, 3 or 4,000 rupees
Your
per
is
day.
a big,
We are
big
going to make
glory.
CT scan free, blood test free, most of the medicines free. So, 1,500 is all the room rent. 1,500 is for 4 or 5 doctors visit.
Quite cheap, quite cheap. I am charging only 20 rupees per patient and everything is almost free for it. So outsider can stay and have food free of cost like that.
I don't
Only
have
20
money.
rupees
I came to Hyderabad
nominal.
only with 2,000 rupees and the maintenance cost is so high. Every day janitor, these. Oof. Last night I had to take 7 sedative injections. I was so stressful how to manage the light, how to manage things. It was
Please
very
take care
stressful.
of yourself.
After
Yeah, I
every
had
30
heavy
minutes,
work.
after every 30 minutes, I'm working as a day and night RMO here. Although doctors are there, but to reduce the cost of the patient, I work as a senior consultant, acupuncturist. I work as multiple physician over here, and I try to save the money of the patient. And let's see how much we can do. One day we have to die,
Sir,
but our goodness will not die.
sir, I am closing my, just right now you said there is cleaning of brain and spine through CSF when we are at rest. So sir, you please take rest and get your that cerebrospinal fluid
I'm still
clean.
work, sir. You can still see me. When I'm work, I work continuously 22 hours. Non-stop, you can see. When I start my clinic at 9 or 10 o'clock, there's 120 patients a day. Non-stop work I do. Not a
It's
single minute I sit on the sofa. Non-stop.
you are doing a very good job, very good job. ये I can't do due to certain limitations, family limitations, this, that. 36 रख रहे हैं पढ़ने की भी आदतें बहुत हैं तो क्या बताऊं मैं
See, I
आपको
am an
मेरा
orphan. That is the best benefit. I have no liabilities. Even if I die, I don't care.
I'm your elder brother. You come to me. I will look after you.
I didn't know why
It's
to
my
take it.
gentleman promise. It's
Why
my
to take
promise.
additional headache? Why to take additional headache? Let me
No
die.
headache.
For my whole my
No
profession,
headache
I
for
was with the patients. I gave 33 years to the patient. And you will find that I may return a book. Again, a new book has been completed, Brain Paralysis Made Easy. And very soon things will come to the market and you will be able to recover. So I'm trying to teach the basics of the subject and please try to learn and you do the good for the patient.
Okay, sir.
With
Please you
this,
take rest now. Please
I have
take
to go to
rest
clinic,
tomorrow.
sir. My clinic starts now. Orthopedic doctors will come. We are going to giving now intraoperative stem cells. We are giving stem cells near the canals. We are giving brachial plexus. We are giving what you call ये क्या बोलते हैं इसको I forgot this word. क्या बोलते हैं इस bone को?
Clavicle.
A clavicle block. Yeah, we give clavicle blocks and all at night in the stem cells. So we are doing, and what is the cost? 500 rupees.
Quite cheap. You are doing a good work. When I was in service, मेरे को बोलते थे कि ये beggars का इलाज करता कराइए. It was known there. He is a poor man beggars doctor. Beggars doctor. तो ये मैं
What
सुनते
will
ही
we
रहता
do
था.
by becoming rich? One day you have to die. So what to take is nothing. What we will take only one thing is our good work. And with this, I thank each one of you for hearing me. Tomorrow the lecture will continue. Please keep the slides. I have to go to clinic. It is almost 2:13.
I'm sorry.
People are waiting.
I am sorry. I took your
No, sir.
time.
It was very enjoyable talking to you. I'm happy that you still talk to me and you guide me in the Facebook. I reach each one of your comment, but it is very difficult for me to write answers because I have lot of MRIs from all over the world. I get MRIs from Italy, France, Germany. So I have to reply all and all the time because my hands have tendinitis. You can see I have a cellulitis here.
Yes.
I cannot type too much. So sometimes it becomes very difficult for me to manage my work because I have to live my life all alone. And then manage 44 inpatients.
Doing marvelous and unbelievable work.
And by next year, we'll be managing more than 100 patients. And so we are training ourselves how to work with 100 patients.
God bless you by always.
And very soon, you will see, we will teach you how to do brain mapping with 144 slice CT scan. And then you will see how brain lesions are reduced with non-invasive dry needle brain stimulation in MRI. Both comparative MRIs you can see together. As we are doing in NCV, today we do the NCV and tomorrow we check that how much conduction has come in the nerve.
I know how to study EEG. Now EEG is all outdated. When I was in AM,
We have EEG and with the help of EEG, I do brain mapping and this brain mapping is very successful. Within 2 minutes, you can see in many cases, I have recovered paralysis patients and they can walk staircases. So we have done wonderful work in transverse myelitis. Also we have worked and other patients also we have worked. Some patients we take time, some we don't take time. That's all.
dorsalis and other problems like that.
Anyway, sir, I will take your leave. My patients are waiting. Thank you. Terima kasih banyak.
Please take care.
Thank
Best
you so
wishes
much,
from my-
sir. Terima kasih.
I'm sorry, I was
Thank
too
you.
fast.
Thank you.
I was too fast, but I have to complete a big
Yes,
topic.
sir. Thank you so much.
7 minutes. Please keep the slide.
Thank you, sir.
Walid,
Yes.
Walid,
Thank you, sir.
Walid,
Please, everybody quiet.
Walid, please
Yes,
keep
sir,
the
speaking.
slide up to now. I'll complete the slide next day. These are the basic things. If you don't understand again the basics, you will forget everything what I will teach in tumor future because tomorrow I'm going to teach you neuroanatomy, completely pure neuroanatomy, pure brain stimulation. Oh, I will teach you like this. This is the brain. So here you will insert the needle with the help of the 3D. So the skull will be removed with the help of the computer and then you will see the motor cortex over here and this is the hand area. Insert the needle here and stimulate and you can recover what? Paralysis. Right?
Right, Sastriji.
Yes, sir. Waiting
So
eagerly to that moment.
So I request you to make more than 200 students. At least I can invite other teachers. If you don't invite 200 or 300, people will not be interested to teach for free. At least the crowd should be there to hear them, right?
15,000.
So I request you to arrange 200, 300 students so that other teachers like microvascular surgeon, how stem cell therapy is given, what is the benefit of stem cell therapy, how stem cell therapy is developed, all this I can teach you and you will be benefited with this knowledge, right?
It's 10,000 there. So
Can you hear me?
8,000.
Yes, sir.
Thank you, everyone. I hope I was not too fast, but thank you. Thank you, all of you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you for the blessing. Thank you for the
Namaste.
kindness. Thank you so much.
Thank you.